Thank you very much. It's really exciting for us to be here. And Umut, Gurkan, and I, Professor Gurkan, we are working on a smart project for Vodafone. And in addition, Umut is also an inventor of some of this technology that I'm going to share with you. And I am, thanks Umut, I am the CEO and the co-founder of Hemix Health. And Hemex really is at the core of some of this exciting work that we're talking about. And what we're really doing here at Hemex is, for most of us here today, here in the US, if we're sick, we can go to a sophisticated lab and have our blood test done. But unfortunately, for most of the people in the world, that's not an option. And in all of our lifetimes, there is not going to be enough diagnostic labs, there's not going to be enough high-end equipment, and there's not going to be enough lab technicians. So we realized there really needed to be a different paradigm to go after the developing world and be able to give people the diagnostics that they need. So we started at Hemex looking at malaria, and I think a lot of you know about malaria. There's a need for 1 billion tests every year for malaria, and it affects half the world's population. But unfortunately, these tests take a long time. So most of the places you're testing for malaria look like this crowded room where people are waiting to hear what the results are. And they're not fast enough to be able to screen villages and find people that are carrying the disease. I'm also going to talk about sickle cell. And sickle cell is actually genetically related to malaria, so it ends up showing up in a lot of the same areas. But sickle cell is really a neglected disease, because it happens oftentimes in the very worst areas in the developing world. You see it a lot in Africa. We see it in the tribal areas in India. And really, there's very little available to really even be able to diagnose a sickle cell disease. So as a result, most of the children in the developing world die by age 5. But the important opportunity here is if they were diagnosed and really given minimal, affordable treatment and education, 70% of those children would live. So here's a huge opportunity to make a difference. So what we've really done is developed a diagnostic device at Hemex that could start to solve these kinds of problems. And we really just start with a finger prick of blood to test these. They go into a disposable cartridge which is inserted into the reader. And this reader could be used by an entry-level healthcare worker. It does not require a physician, and it gives them the information right away about what the diagnosis is. This reader is really rugged and reliable. It runs on battery. It can go up to very hot conditions. It can be in a rainstorm, you can do it. And it also has GPS information. So what we're doing with this Vodafone project is really this last step. This reader is wireless and can transmit the information. And we're really in Nigeria doing a partner project to be able to take this information and store it and be able to download this to the clinicians, to the public health workers so they know where to send the resources, and also even to the patients, because these patients need a record of what their children have. And to be able to stop their children from dying, they need to be able to know the diagnosis and be able to get the treatment and education that they need. So because we could do this, there's 2 powerful technologies like the one that Umut invented that's part of this reader. And we've already done clinical studies with this, so we've done hundreds of patients in India and Africa, and we know that in 1 minute we can do an accurate test, and actually it can be more accurate than the current diagnostic. And again, it's affordable, a 1-minute test for $1 for malaria. And that for sickle cell, we can do a $2 test compared to what we have to do today, which is buy a $30,000 piece of equipment. You need a trained lab technician, and this is why in many countries in Africa, there may be only one of these high-end devices available. But we have something that's very accurate that you can do for $2. So that's how we can make a key difference and then be able to connect all this information electronically. So we have a lot of these units that we're developing this summer and going to be sending them out for more trials. And we're making these in India so that we can make them very affordable. And in India, where they have 60,000 private labs, often very primitive, but it's where 80% of the people go to be diagnosed. We're going to try to be able to provide this kind of technology there. So Hemix Health and where we're going next is to be able to do this kind of product, I mean, it takes a village. And it really is needed to bring all these people together for partnering, for funding, for getting the technology to the last mile. So we hope at this conference, for some of you will be inspired by the work we're doing and you'll come and talk to us. And we're very interested in getting your feedback. We want to develop, obviously, a profitable company, but also one that can be life-changing for many people. Thank you for the chance to tell you about it.